Good afternoon. My name is Dr. Joan Reed, Dean for Diversity and Community Partnership at Harvard Medical School. And I want to thank you for joining us on today's webinar on climate change and health equity. There are more than 200 registrants participating in today's discussion: physicians, scientists, faculty, students, trainees, administrators from a wide range of disciplines and organizations. This webinar is part of Harvard Medical School's Office for Diversity, Inclusion, and Community Partnership, Equity, and Social Justice Initiative. This initiative was established to address issues related to health disparities, social determinants of health, leadership in health systems, health policy, and other areas affecting vulnerable populations. ESJ events focus on 4 areas: history and context, culture and environment, health disparities, and leadership and skill development. This series is sponsored by the HMS Office for Diversity, Inclusion, and Community Partnership, DICP, and the mission of DICP is to advance diversity and inclusion in health, biomedical, behavioral, and STEM fields in ways that build individual and institutional capacity to achieve excellence, foster innovation, and ensure equity in health locally, nationally, and globally. DICP efforts support the career development of junior faculty, trainees, and students, identifies and trains leaders in academic medicine and health policy, and provides programs that address crucial pipeline pathway issues. A few housekeeping notes as we begin today's session. The chat is not available and microphones will be muted. However, you can use the Q&A to post questions for panelists. This webinar is being recorded and will be posted on the DICP website. And now it's my pleasure to introduce Dr. Alden Landry. Dr. Landry is an emergency medicine physician at Beth Israel Deaconess Medical Center, assistant professor of emergency medicine, and assistant dean in the Office for Diversity, Inclusion, and Community Partnership at Harvard Medical School. Dr. Landry?
Thank you, Dr. Reed, for the introduction and setting up the stage for this discussion. And thank you all for joining us this afternoon or this morning, depending on where you are, for listening in and being a part of this really important discussion as we discuss climate change and health equity. This is a lecture that is a long time coming, and as some of our speakers know, we actually tried to pull this presentation together a few months ago, but had some technical issues and scheduling conflicts that prevented us from doing this. But we're glad that we are here this afternoon to have this discussion and really focus in on the impact of climate change, which is a discussion that we're talking about on a national and international level, but really want to focus in on a local level and what this is doing to our most vulnerable communities, the individuals that are coming from those minoritized backgrounds, those historically excluded and underserved backgrounds. So as we have this discussion, I really want to focus in on the global perspective, the national perspective, and then bring it down to the local and individual perspective. And I think our panelists are going to do a great job at doing so. I'm going to introduce our panelists very briefly. They have phenomenal bios that we'll be sure to share with you on our website. And as Dr. Reed mentioned, the discussion is going to be recorded and available, hopefully within the next few weeks. But our speakers are today Dr. Gaurav Basu. He is a physician and founding co-director of the Cambridge Health Alliance Center for Health Equity, Education, and Advocacy. He is an instructor here at Harvard Medical School and faculty affiliate for the Department of Global Health and Social Medicine. He is also a health equity fellow at the Center for Climate, Health, and Global Environment and faculty affiliate at the FXB Center for Health and Human Rights at Harvard Medical School and Harvard T.H. Chan School of Public Health. Next, we have Dr. Caleb Dresser. He's a colleague of mine as another emergency medicine physician at Beth Israel Deaconess Medical Center in Boston. He's the assistant director of the Fellowship in Climate and Human Health and an instructor here at Harvard Medical School. He is also an affiliate at the Harvard FXB Center for Health and Human Rights and the Center for Climate, Health, and Global Environment at the Harvard T.H. Chan School of Public Health. His research focuses on understanding the public health and healthcare implications of climate-related disasters. And last but certainly not least, we have Dr. Tracy Henry. She is an associate professor of medicine at Emory University School of Medicine, a clinical educator and attending physician in both inpatient and outpatient medicine. She is an assistant health director for the Grady Primary Care Center and co-director of the Health Equity and Advocacy Policy Track for Emory's graduate medical education programs. Dr. Henry's teaching and research interests include health care advocacy and policy, integrating behavioral health into primary care, quality improvement and patient safety, as well as climate and health equity. I think, as you can tell from the individuals that we've selected to be our panelists for this discussion, that they're bringing a lot of experience into this and really an interest on equity and advocacy into this space. And I'm going to turn to you, Dr. Basu, to start off our conversation. I really want you to set the stage for us. Can you tell us where we are with climate change and what the current projections are telling us if we don't make any changes?
Yeah, thanks so much for the question, and thanks for having me. And I'm excited to be here with Dr. Henry and Dresser. And let me just say first word that I'm really glad an office like DICP is doing this. A lot of us in equity work, social justice work, racial justice work. I'm really excited for this community to be digging into the work of climate change. You know, I only came into this work in climate change in 2018 after, focusing as I do now, much of my work on racial justice and health equity. So really excited to be here. So setting the stage. What I'll start by describing is that in 2015, the Paris Agreement was signed, which really set the stage for the way we think about many of our milestones globally. So that agreement that was signed as part of the UN negotiations said we commit globally to keeping global warming 2 degrees Celsius or warmer. Poor communities, coastal communities around the world said that is not nearly enough and fought to have the inclusion of a goal of 1.5 degrees Celsius. So many of you have heard those landmarks and know that that's a part of the conversation. My wake-up moment in climate change was in 2018 when the UN IPCC report had a major groundbreaking report of the top climate scientists around the world, showing some stark data saying that in order to meet 1.5 degrees Celsius of warming, we need to end all human-made greenhouse gas emissions by mid-century 2050. In order to do that, we've got to cut them about 45% by 2030. And so basically the major headlines of this study was that climate change was, these markers were happening a little sooner than I appreciated at least, and we had a heck of a lot of work to do. So here in 2022, what I'll say is your question, where are we? Setting the stage. I think many of us in the climate work hold this reality, this kind of hard thing to get your head around, that never before have we seen the impacts of climate change impact our communities here and around the world as much. It's more scary than ever because we're seeing it. And we are, that window is getting closer and closer to 2030. And at the same time, never before has as dramatic of solutions been at play. And so this imagination of this world we can make is more possible than ever. And the stark realities of climate change are becoming more real than ever. And that's something I think we just got to hold. And Lynn, if I could just ask you to share a couple of those slides. Let me just briefly show you a few graphics that might be helpful in explaining where we are. So the Global Carbon Project, I think, is the gold standard of global carbon dioxide emissions. I'm not going to go through all of this, but you can see decade by decade how we've been increasing carbon dioxide emissions throughout our history. You can see how it went down during COVID, but unfortunately we've bumped back up, and this isn't updated for 2022. And so we have not peaked in global carbon emissions. But again, we said that we got to half our emissions, which means like cutting our emissions by about 8% every year by 2030. So this is a slide that shows us that we're not on the right course right now globally, and we've got a lot of work to do. The next slide highlights exactly how much of a change in slope we really need to have. So to hit those markers, 1.5, 1.7, 2 degrees Celsius, you can see how much work we have to do to cut our emissions dramatically. So this is a time for ambition and urgency and all of us being involved in these solutions. At the same time, the last slide here, Lynn, will show us the possibility that is before us here as well. So this is from the Rhodium Group, This is a US-based slide. And you can see through all the mistakes we've made, all the lack of policy, the lack of guiding principles to address climate change throughout the last 20 years, we have been slowly decreasing our emissions, okay? And the light blue there shows first our Copenhagen agreements and then our Paris Agreement. So if you go to the far right, you can see that's where we need to get to meet that 50%, the US commitment is 50% by 2030. And so for all the mistakes we've made, I look at this graph and say, there's no way we can't do this. You know, of course we can do this. And so I think that takes that conviction of we have to do this, we will do this, and we have got to kind of transform our society to make it happen. And I actually believe we can do that.
It's interesting that we're starting off a conversation around climate change with hope. And I want to say, I'm glad that we're in that space. And I think Ingenuity is going to have a lot to play in that. But I want to maybe take it a step back because I think naming matters. And I distinctly remember as a kid hearing about a hole in the ozone layer. And then we were talking about global warming. And now we're talking about climate change, and something that is really important in the public health space is naming. And so as we are changing the name in these issues, does it make a difference? And how do we make sure that our audiences that we're trying to engage actually understand that we may be talking about similar topics, but we're emphasizing a different component, at this specific time?
Yeah, it's a great question. And, the history of the words here, global warming was what we were using in the early 2000s, I would say. And it was actually like political partisan consultants who were trying to supporting fossil fuel industries who helped change the word from global warming was considered scary to climate change, which kind of diluted the concern about it. So the point I'll make, Dr. Landry, is that words do matter. The way we talk about it is framed by our public discourse about this. And so maybe the point I'll make is, as health professionals, people who care about equity in the audience here, we play a major role in communicating and framing these issues. And you see how kind of our political systems have changed the words, and we can change the words also to explain the impacts of air pollution on young children who should be in school instead of the emergency room, about young families who are running away from natural disasters around the world. We can make this very human. And so when we use words, the critical role we play, I believe, is to make this about morality, about humanity, about taking care of our patients. And I think we're uniquely positioned to do that as healthcare professionals committed to equity work.
Thank you. And I think what I'm hearing is we're shifting the conversation to make it politically palatable for some individuals, but still recognizing that the issues haven't changed. And from a health perspective, which is really the purpose of our discussion, we're going to start to tease into that a little bit more. Can you give me a little bit more about what's happening on a global level when it comes to climate change? What are some other countries experiencing? What are we starting to experience here in America? Just give us that global picture of what's happening with climate change.
Maybe I'll just give a quick story. So my background is in global health and human rights work. And so since I was a student, I've been working with this organization called the Child in Need Institute in West Bengal, India, which is where my grandma grew up, in a rural village near the Bay of Bengal. So in 2020, I am reading a study by the Proceedings of the National Academy of Sciences showing this correlation of the increased frequency of super cyclones, super hurricanes around the world, showing a correlation. A week later, I'm reading, in the news that day I hear, hey, a week later, we're concerned about this hurricane that's now in the Bay of Bengal that might come through this rural area of Bangladesh and West Bengal. The short of it, this is the height of COVID cases. It decimated these kind of villages that I've been working with for a long time. People running away from this natural disaster, their huts being knocked to the ground, going to emergency shelter where they're worried about getting COVID inside, worried about getting hit by trees outside. So that picture always comes to my mind when I think about the global impacts. And the truth is that climate change is an inequity multiplier. It finds the fault lines of injustice throughout the world and here in the United States, and it turbocharges them, and they're built out of the same oppressive injustices that touch all these issues that we care about. But the scale is dramatic. And so, I think about natural disasters, I think about the impacts of infectious diseases, the connections between pandemic mitigation and investing in our planet, water scarcity, food insecurity, So all these things that we're trying to make a progress around the world, this community now, the children stop going to school and are helping their families try to make money at home now. The child nutrition programs were upended. It hits upon the foundations of everything we're trying to do to make a more just world order. And that's why I think it's critical that we invest in our planet to address all those human issues we care about around the world.
And can you just say that term for me again? Did you say inequity multiplier?
Yeah. I think if you look around all these things that we see, the histories and legacies of racism, these unfair economic systems that have allowed some people to thrive. Dr. Tamara Jones's definition of structural racism always comes to my mind, that we are unfairly advantaging some individuals and communities and unfairly advantaging other individuals, community, and sapping the vitality of all of humanity. Like climate change immediately comes to my mind when I hear that definition of structural racism.
Thank you for bringing that to the audience. And my last question for you is, why should healthcare systems, public health institutions, nonprofit organizations care about climate change, and what can they do?
Yeah, listen, we're all here to take care of people. We care about our patients. Our patients' stories are at the heart of why we all come to do this work. And we have to recognize that healthcare systems offer a great opportunity. Again, I'm really focused on this work of communicating and supporting the public discourse and getting involved in policy. I think policy really matters. And so a real credit to a lot of the Boston-based hospitals that they signed the HHH pledge, BI being one of them, that I know you and Caleb are at, where they committed to these scientific markers of decreasing their emissions by 50% by 2030 and ending them by 2050. US healthcare emissions from the hospital systems are about 8.5% of all emissions. So if the US healthcare system was its own country, I think it'd be like the 13th largest emitter in the world, right? So we're an energy intensive system. There's a false notion that either you take care of patients or you are green or sustainable. That's really, there's great organizations showing us a path forward to be sustainable and good for our patients. So this is part of our commitment to our patients to stop the waste, stop the pollution, the emissions. And I've never seen as much of a galvanized movement for the healthcare system to be a part of solutions as I have now.
Awesome. And I just want to double back on the point you said. The US hospitals contribute about 8.5% of our total emissions. Is that correct?
Yep.
All right. I'm just going to file that one away for future quotes and references, because I think that's something that we don't think about as in healthcare, is what our roles are as institutions in this space. Thank you, Dr. Basu. I want to turn now to Dr. Dresser. Caleb, I've watched you grow in this space from a trainee to faculty, really thinking about the importance of addressing climate change on a local, national, and international level. And we just heard a discussion about what our systems should be thinking about when it comes to climate change. But I would love to think about this specifically from a physician level perspective, from a provider level perspective. Why should healthcare providers, how should physicians be thinking about this, and why should we care about this issue?
Thank you, Dr. Landry, and thank you everyone for joining us today to talk about this. From my perspective, look, this is happening and it's affecting all of us. I'm an ER doctor and I'm already seeing impacts. I've treated people displaced by hurricanes. I've treated people affected by heat stroke, and I've treated people who've lost access to their usual hospital because it flooded during an extreme rainfall event. All of these are the types of clinical scenarios that we can expect to see more of as the climate continues to change. And when we think about our healthcare system, Dr. Basu was alluding to the greenhouse gas emissions, and that's a really big piece we need to deal with. We also need to make sure that our healthcare system stays open and accessible to patients and communities that are being impacted by climate change. And I think when we look at the geography of that, both locally and nationally and internationally, some of the biggest impacts are also happening in places where the healthcare system is more fragile. And so there's some inequities of resilience of healthcare systems and of access to care to come with this. As physicians or PAs or nurses or physical therapists or whatever your role is in healthcare, I think we have a series of interlocking responsibilities to take action on this issue. First, as Dr. Basu was alluding to, we have a responsibility to our patients. If we see something is affecting them, I think it is our job to speak up about that. And we have a privileged position. We have been the beneficiaries of great educations, and we get to talk with our patients and see what they're experiencing. We need to share that information with our policymakers and with broader society so that we all understand the urgency of what's happening. Because climate change is exacerbating a lot of existing inequities. And I often think of it as another social influencer of health. In the same way that somebody can live in a food desert in an urban area because they can't walk to a grocery store, well, they can also live in a floodplain, and that's going to have real impacts on their health if you look at that over the course of years. Second, I think we need to be taking action to build a climate-ready health system, and that means both decarbonizing, getting that 8.5% of US emissions down, and also making sure that our hospitals stay open when there's a fire, when there's a flood, when there's a power outage, and that patients have somewhere that they can get care. Finally, I think we also need to remember that we're people. We are not immune to the impacts of climate change, and I personally would like to inhabit a world that is safe for me and my family and that values everyone in it.
As you were talking, it made me immediately think back to Charity Hospital during in New Orleans when Hurricane Katrina struck, and how so many individuals were either trapped in a hospital that was literally collapsing with failing generators and lack of access to healthcare, and many individuals having to be transported out of the area. And then thinking about what happened afterwards. I'm originally from Houston, Texas, and thinking about all those individuals who were displaced and having their healthcare displaced as well. Thinking about those individuals who have end-stage renal disease and need dialysis, but they're displaced and they need to find another place to have access to dialysis while also being internal refugees from a hurricane. So it evokes a lot of thoughts of prior experiences based off of what you just said. So I guess leading to that, you led into this, and part of my comments were sort of in that space. How does climate change impact the health of an individual and the community? And I think we could talk about it from the acute standpoint, but then also from a chronic standpoint. How does this longitudinally impact health for individuals and communities?
Great question. And I think everyone on this panel today is going to share different aspects of this because it's a really complicated answer. I'm going to give you my overview, and I think we're going to probably come back to this question a few times. And I can see there's already a question from one person in the audience about this as well. So I think first we want to think about short-term direct impacts. So greenhouse gas emissions occur, that results in warming of the planet, that results in intensification of a lot of things like the amount of energy in a hurricane, the amount of drought that we might deal with in a drought. And so we get more extreme versions of a whole lot of problematic weather and natural hazard things. Those in turn can lead to heat stroke if it's a hot issue, drowning if it's a flooding issue, smoke inhalation if it's a fire issue. And so those are, I think, relatively straightforward to understand and are scientifically approachable in studies. And so we have very good literature around, for example, heat-related illness and what we can expect as a result of climate change. The second category is a little more difficult to get your head around sometimes, but is really important because this is where a lot of the long-term impacts on our society lie. And these are long-term changes in things like how much rainfall you get on average over a course of many years. Well, if that's decreasing and you depend on rainfall for agriculture, maybe you can't do farming where you used to do farming, and that's going to have impacts on livelihoods, and it may result in displacement both within a country or across international borders. Sea level rise is happening. That's going to not only result in higher water levels and flooding, but also is going to do things like result in salt water getting into the water table, meaning that maybe that well that worked in a coastal city doesn't work anymore. And we're going to be seeing shifts in biomes. So as the planet warms, the suitable zone for certain Insects, for example, ticks and mosquitoes, well, that's shifting north in the northern hemisphere or south in the southern hemisphere. And so we're seeing new patterns of infectious disease. So all of these long-term and indirect effects on things like infectious disease behavior, livelihoods, human migration, all of those are going to have profound impacts on society. It's a little bit harder to measure those in an observational study right now, but I think we need to be giving a lot of thought to those, because when we return to issues of health equity, access to care, and outcomes, it is those social situations. Do you have money to go to the doctor's office? Do you have a functioning transportation network, or was it flooded? Those are the things that are going to affect people's health long term. Third, I want to touch on the ongoing use of fossil fuels. So when we talk about the health impacts of climate change, we're often talking about climate change happening and resulting in hazards, but it's worth remembering that climate change is caused by burning fossil fuels. And when we burn fossil fuels, we get a whole lot of dirty particles in the air pollution, and those affect people's health. And so we can look around the world and see that something on the order of like 5 to 7 million people a year are dying from air pollution. The vast majority of that air pollution is from fossil fuel use. And so steps that are taken now to reduce fossil fuel use and switch to cleaner forms of energy, well, those are going to have immediate health benefits. And the benefits are going to be in communities where fossil fuels are being burned. And those are disproportionately poor, Black, brown, and minority communities. And so there's a lot that can be done to address health equity by moving to a cleaner set of energy systems. And then finally, I think it's worth talking about mental health. And I'm going to not go into that because I think Dr. Henry probably has more to say on that than I do.
Awesome. And my last question for you is, we've talked about the problems, we've talked about the impacts, but what are some of the interventions that we can do to address climate change and to improve overall health, aside from, everyone driving electric cars?
Yeah, and I want to break this into a couple of levels, because I think for everyone listening to this, anyone who's concerned about climate change sees this as a big problem, and the solutions are really challenging because some of them are really big picture and it can feel hard to act on those. So I want to emphasize big picture strategic stuff, but also talk a little bit about human scale stuff that you can do right now. So first and foremost, we need to get our economy off fossil fuels. Big picture, that's going to mean moving toward sustainable systems, wind, solar, other forms of energy that do not involve burning oil and coal and gas. And that's going to have immediate benefits for health. And long-term is going to mean less total warming occurs, which means we don't see as many of those severe heat waves or fires decades in the future. That's a big picture policy problem at the scale of nations and international agreements. It's also something you can address in your daily life. And so taking steps to reduce air travel, reduce red meat consumption, those are things that are within your sphere of influence, but those are not sufficient. I think it's still important to stay engaged in the big picture policy process, because that's how we're going to get real solutions here. Second, I think we need to deal with impacts. We now have 1.1 degrees of warming since the 1880s already has occurred, and we're seeing flooding in Pakistan. We're seeing huge hurricanes in the United States. We're seeing wildfires around the world. And over the course of my career, I expect we will see something closer to 2 degrees of warming and perhaps more. Dr. Basu was showing you some of those graphs. So I think we need to be preparing for impacts. And that means, yes, we need to harden our hospitals against these hazards, but we also need to invest in the infrastructure of society that keeps people safe and prevents them from needing to go to the hospital. Making sure the power grid is stable so people can run their nebulizer or their home oxygen machine at home and that they don't need to go to the hospital. Making sure that their housing is safe. Housing is a huge issue in terms of vulnerability to climate-related disasters, and improvements in things like building codes can have a real impact on the safety of our patients in the community. And then finally, I think we as individuals, as organizations, and as members of communities need to be reaching out to those around us to take steps to keep one another safe. And these can be pretty simple. There's a great program in New York that has involved pairing people up to do a phone call or a door knock to check on a senior citizen who is at home during a heat wave. And this is based on science that shows that a lot of the people who have bad outcomes, go to the hospital, sometimes die during heat waves, are elderly and live alone. and that just having somebody check on them once a day might be enough to save their life. And that's a pretty easy ask. And so that type of program is actionable, it's not very expensive, and that's something you could do in your community if heat is a problem in your community. Another example, Dr. Landry was alluding to dialysis. Well, there is evidence that getting people in for dialysis the day before a hurricane arrives saves lives, because it gives people a couple of extra days to figure out where they're going to get that next dialysis session as society tries to get the power turned on to the dialysis centers and the floodwaters go down after a hurricane. So again, that's something where we already have the infrastructure. It might mean if you're a healthcare manager, bringing in a couple of staff overnight the night before a hurricane arrives, but that's actionable, that's doable without a hugely complicated program. And finally, I think we need to be educating one another in the health community and our patients about what these threats are, because a lot of these solutions are not going to come from people like me. They're going to come from people who are living in a situation, understand what's happening, and come up with their own solutions.
You know, as you were talking, I was hearing your discussion around some of the policy interventions that can happen. You mentioned building codes, and I often go back to that public health phrase, health in all policies. And we often don't think about that, but building codes and how a house is built with the type of walls and the type of windows that it has and any other expectations can have a huge impact on a person's ability to survive a hurricane. And I think about building codes in Florida and compared to maybe other states that are prone to hurricanes in the South and along the Caribbean. And I know that Florida has more aggressive or more meaningful building codes when it comes to having the houses be hurricane resistant. And then I also was thinking about what's happening with California, and they recently passed a bill saying that no new vehicles sold in the state after the year 2035 can run on gas. They all have to be electric vehicles or something along those lines. And so maybe if you could just take a second to think about, like, you know, what are some other policies that you may know of or things that you've seen that are actually potentially going to move the needle that are health in all policy type of mentality that we should be thinking of?
Yeah, I mean, I think one big area is empowering community level decision makers to actually have funding and decision-making authority to take steps. So in Massachusetts, we have something called the MVP program, Municipal Vulnerability Preparedness Program. And that's a state grant program that gets grants of a few $100,000 into the hands of municipalities so that they can decide what to do at their level. And those have been used by a lot of highly impacted or highly threatened communities in Massachusetts to do projects that they feel are appropriate to their community's needs. And I think that is a really important approach, because those solutions, when you go through the list of grants that have been awarded, are incredibly diverse. Some of these are like community level surveys and community-based action research stuff. Some of these are building like berms to keep floodwaters out. So it spans the full gamut from like socially oriented to engineering oriented, depending on what that municipality and the NGOs it's working with feels they need. So I would advocate for more of that, because I think it's very hard from a high level to understand what all of the needs will be at a local level.
Awesome, thank you. And thank you for continuing to bring it down to the local level. And I think that's a great transition as we go to Dr. Henry, who's going to be joining the discussion now. So Dr. Henry, again, getting more and more specific, who is at risk due to the impact of climate change in the U.S.?
Great. Thank you, Dr. Landry. It's a pleasure to be here this afternoon. While climate disasters can really affect anyone, it's low-income communities and people of color who are hit first and worst. And they're more likely, and this is because they're more likely to live along flood lines, neighborhoods that are at risk for flooding. They're less likely to have green spaces, access to parks, or they live in polluted areas. And so I'm often asked by learners and colleagues and friends, so aren't we all on the same planet? Are we all experiencing the same climate change hazards? And I say yes, but we experience them unequally and in an inequitable fashion. And in fact, Those who contribute less to climate change are resource poor communities, our immigrant populations, those with limited English proficiency, our persons living with disabilities, or older adults. They are less likely to contribute to climate change, but they have the greatest disproportionate impact that they're experiencing. And so when you think about the United States and the healthcare sector and how much we spend on and contributing to our carbon emissions and climate change, we are affecting those populations who have less of an ability to respond to climate change hazards. And so I like to think of the term adaptation. So it's that resilience, the ability to respond, to have the resources. I remember I'm from the Gulf Coast. And so during Hurricane Katrina, I remember people were saying we have to evacuate, but not everyone had access to evacuate. Not everyone had a rainy day fund to travel, or did they have a car to travel, to leave the city, to leave New Orleans, to get a hotel, family in another state. And so it's really that idea that those who are most impacted by climate change contributed less, and they have the less ability to actually respond to climate change hazards. And Lynn, if you can show my first slide. Next. Next. All right. So here, as we've heard from our prior two speakers, that climate change really is also a social determinant. And what you see here, I like to use this iceberg analogy, in that it's important to recognize that individuals experience climate change are really only the tip of the iceberg. And below, what we see are the broader foundations of systemic racism and all of the effects that contribute to the disproportionate effects of climate change on our resource poor populations, on our communities of color. We see there's societal, social, educational impacts. It's misinformation or disinformation. In the communities, in the papers, there's a lot of sort of language and social media that climate change is not real, climate change is something in the future, climate change is abstract. And even when you think about that, those who can even say that it's abstract are coming from a place of privilege, because they actually don't have to respond necessarily to climate change in that moment. But what we know is that our patients, our communities that are most affected are actually living it. And so we really have to think about it when patients come into the clinic, when they're coming in with COPD, when they're coming in with this sort of weird overlapping respiratory illness. What is going on beneath the tip of the iceberg in our society that's contributing to the health or lack of health and wellness when they present to you in the clinic? Next slide. Thank you.
So, I think your slide is already leading to this. How will a climate change impact those most marginalized communities here in the United States?
Right. So, whether these changes, the biggest reason I always like to say is sort of that allostatic load and the cumulative collective stresses. And someone mentioned earlier that climate change is a threat multiplier. And our patients that experience these stresses by resource poor communities, they've struggled for years for clean air, nutritious food, quality drinking water, and safe shelter. And the other biggest issue is that they are already living with pre-existing conditions. They're already affected by chronic disease. And so when they experience climate change hazards, it makes it worse. And another example could be a lot of our patients from resource poor communities, they are living with limited income, and they're more likely to live in subsidized housing, which is more likely to be along a flood line. They may have more problems with mold, more respiratory issues, inadequate insulation. And so I see a lot of this patients coming to the clinic, they ask me for a prescription or a note or something to tell their landlord, can they clean the mold in their homes? Can they address what's going on in their communities? And so, cumulatively, this is a threat multiplier. This is what we see in the clinic. And we need to be able to recognize these things and address the inequities when patients come in to see us.
And then lastly, how can systems and individuals begin to engage policy? Caleb was starting to talk about this and really talked about some of the grant opportunities that are happening here in Massachusetts. And I think that's really important to hear. But what can we do to empower individuals to be engaged in the policy to address the looming impact on these most vulnerable communities when they have so many other pressing matters that they have to address? You know, we're asking, oftentimes we ask those who have the least amount to do the most. And so how can we empower those individuals? How can the systems work with those individuals to be involved in this process to address climate change, knowing that they are going to be the ones that are going to be most impacted?
Right. I like to think about how we address climate change through policy using the socio-ecological model. Lynn, if you want to just briefly show that, the last slide. Well, the socio-ecological model is really how we think about, can you advance the next slide? Yes, thank you. And so I like to think about our individual and collective responsibilities in addressing climate change. It seems so overwhelming. Many people are like, you know, so what can I do? Will one person's effort make a difference? Well, everyone's effort makes a difference. And I like to think about what we can do in the individual level, institutional, community, and what we can do nationally and legislatively. And so I will start with legislative as because when you have top-down policies, a lot of that drives what we do and makes what we do on the front lines as clinicians and what we do individually more sustainable. So I like to mention that, you know, we've had some legislative wins with the Inflation Reduction Act this year, which will allow some tax credits for people who are buying energy efficient appliances, electric vehicles, and so forth. And then also with this, with our current administration, we have the new Environmental Protection Agency's Office of Environmental Justice and External Civil Rights. And then we also have the Justice 40 initiative. And so with that new office, we heard a lot about community work and working with our communities and figuring out what are the resources. And so that new office is actually going to work directly with communities to adjust environmental concerns and equip communities to be able to respond to climate change hazards whenever they occur. And also with the Justice 40 initiative, I think is really great that the federal government is planning to deliver at least 40% of overall benefits from federal investments in climate and clean energy back to the disadvantaged communities or historically marginalized communities. And that is prioritizing the communities that we need to put first. We need to put the health system resilience at the forefront. And so investing in historically marginalized communities will help us on the front end, and prioritizing them is the way to go. And then also thinking about what we can do from a community standpoint. So the CDC has a new framework as well. It's a 5-step process. And this is something we can also do at our local institutions as well. And a lot of what I did back when I lived on the Gulf Coast. So we actually start forecasting and predicting what can we do for our patients when a climate disaster, if it's something that we can predict, do we have a climate action plan? Those are some of the things that we are working on, things that we're doing in our clinics that we can help prepare our patients for disaster. Do they have a place to go the next time there's a hurricane or the next time there's a wildfire or the next time there's going to be torrential rains and heavy flooding? And then also thinking about from an institutional level, again, and we're in academics, right? So many schools have moved to educating our next generation of clinicians on how to handle climate change. How do we address and ask the right questions in the clinical visits so that we can help equip our patients? And then also from an individual standpoint, we can all learn more about what we are doing, what our professional organizations are doing. I'm currently working to basically surveying leads of medical societies to see what are they doing to reduce their carbon footprint, because medical societies drive what we do in our professional work. They drive our policies, they drive what they advocate for in a federal level. And so if we really are going to try to make a dent and really reach those goals of carbon neutrality by 2050, reducing by 50% by 2030, we all have to pitch in and contribute to our individual, collective, community, and legislative responsibilities.
You know, Dr. Henry, you started into a space that I actually wanted to maybe drill down a little bit more on, which is medical education. You know, this is not something that I was taught in medical school. This is not something that I've seen in my, I saw in my residency, and this is certainly not anything that I see when I'm doing my CMEs. And so how do you embed this in medical education? How do you stress the importance of these type of topics to learners in the health professions? And how do we make sure that this isn't just a one-off discussion, but something that's actually integrated into curriculum so that our learners, as they become health professionals, as they become physicians, are actually thinking about this as routinely as they're maybe thinking about some other issues that they're often taught?
Thank you, Dr. Landry. So here at our university at Emory, we actually have a new climate and health equity thread. And so we are weaving it through from first year through fourth year throughout their entire medical education experience. And so it's not a one-off course. Taking one of the leads of our climate and health equity thread actually wrote a paper about taking climate-informed care, how to introduce climate-informed care and take a climate history. A lot of that history and that framework is something that we're already doing. But what we need to do is teach our learners the importance that health equity, climate change go hand in hand. You cannot address one without the other. You're not going to achieve equity and climate change until we address other racial and societal equities. And so they actually work together. You can teach them, you can vet them. We have a curriculum that is longitudinal. And then also on the GME level, I have a colleague here that's actually working with our primary care residents, and they're having OSCEs and observed visits. How are they incorporating it? And so they're assessing what our residents are doing when patients come in with the effects of climate change.
Awesome. Thank you for that. Dr. Basu, I want to turn back to you because you've had a chance to listen to your colleagues sort of talk about this from different perspectives. Is there anything that you heard that you wanted to maybe double down on or maybe emphasize that is really impactful in this discussion around climate change?
Yeah, first thing I want to say, Dr. Henry's work at Emory and the medical, I'm kind of a faculty lead for our efforts here at HMS now in climate education. We've been learning a lot from what they've done at Emory, and we're hopeful to model that also. Actually, and I think we're making good progress to have a 4-year arc. So thank you for that work, because it's been helpful for us thinking through it. And I think it's critical because it's not just about learning the material, but the culture of professional responsibility that we can really support learners who are so eager to learn about this. So general reflections, I think, listen, climate change feels very complex and confusing and overwhelming and scary and paralyzing. And I think we're in a time of a lot of those things, right? We're living through kind of an extraordinary time. And it, for me, it takes that work of doing that deeper work, of asking these deeper foundational questions of who we want to be and how we take care of each other, and I think what's come out of this conversation, what Dr. Henry and Dresser have said is, and what you have said is that health plays a really critical role in that vision, right? And I think that's kind of why I want to be in medicine, not just to take care of patients, but because seeing people's health is seeing their humanity and their dignity, and we can do that, and we can see how health professionals have played a major role in speaking up more. I think things are really changing in that way. And so what I think how I've synthesized this conversation, and I think my simple message to the audience is that we all have a really valuable role to play. And I often say it's, I think, Caleb, Tracy, and I are climate people. We're thinking about this climate stuff and working on these projects and all that. You don't have to be like a climate person. I'm still not, I'm still relatively new to this work. I think you have to really, we all know the people and things we love. And I think we're really getting now broadly, how climate change is a threat to that stuff. So speak up for those things you care about and understand how climate can impact that. And there's a really valuable role you can play in that. And whether it's what specialty in medicine or outside of medicine at your kids' schools, there's so many ways to play a role. And it's more accessible than I think you think. And we'd love to work with you in this work.
Thank you. I just want to make sure our audience knows we are open for questions. So if you have any questions, please put them into the Q&A session on the Zoom, and I will try and get to as many of those as possible as we go through our discussion. Caleb, I do have a question for you, and it was based off of something that Tracy had mentioned around sort of embedding this in the educational system, but maybe thinking about it differently. You mentioned about helping people get to dialysis a day earlier, just because it will give them an allotted amount of time. But that's something that actually takes some forethought and planning. I'm just wondering, are there any systems that are in place? We have checklists for everything in medicine. Or is there anything embedded in an EHR or a checklist that people can go to maybe have that questionnaire, an environmental at-risk survey that we can talk to patients about? Or is there something in the works that maybe we can think about as to integrating into our healthcare EHR so that we have this information readily available to support our patients?
Yeah, I think work is ongoing on that. It's worth mentioning as we think about climate change broadly, that what this looks like at the level of your institution, wherever you practice, may be incredibly varied. So here in Boston, the big threats that my patients are facing are heat in the summertime, including the fact that a lot of our lower income patients may not have air conditioning, and extreme rainfall or flooding occasionally from severe storms or hurricanes. And so that's one set of threats with a set of checklist items we might go through, preparedness actions we might take. If you look at what's going on in Northern California, it's a very different threat profile, dealing with things like high wind, fire, air quality related to smoke, and in some cases, mudslides in the wintertime when there's extreme rainfall in areas that burned. And so the educational materials for that are really different. So there is not a single unified questionnaire, because I think you want that to be targeted to the hazards where you are and the needs or risks to the communities you serve. I will say that in my clinical practice, I have started spending a couple of minutes doing a little sort of social safety during heat waves screen when it's really hot out, if I'm seeing patients who have something going on that might be related to heat. They came in with a little bit of lightheadedness or pre-syncope, and I've, let them rehydrate in the air-conditioned ER and I'm discharging them. I will have a 2-minute conversation. It's like, hey, where are you going? Which part of the city? Do you have access to air conditioning? And if not, what can we do to connect you up with that? Either just by suggesting they spend the afternoon at the local library reading a book or surfing the internet where it's air conditioned, or maybe staying with a cousin who has AC for a couple of days. So I think part of this depends on clinicians understanding what their community faces, both in terms of social determinants and limitations, as well as hazards. And then part of it could be integrated into an EHR. And that's something that a lot of people are interested in. I have yet to see a really good example of that having been implemented, but I think that's coming.
Awesome.
Interested if Dr. Basu or Dr. Henry is aware of other tools in that space.
Yes, definitely. Like I mentioned, the climate health history, it's not embedded yet in our EHR, but it's definitely something that we can move towards. And it's literally, you're asking things that you're probably already asking as part of a patient's social history. You're asking questions. It's CH2 OPD2. I like to think about it. So it's community questions, your home, is it greater than 40 years of age, your hobbies, are you working with stained glass or oil-based paints? Those have hazards. Where do you work? Your occupational hazards. You work outside. Your personal habits. Do you live with someone who smokes? Your diet, your drinking source, meat consumption, any medications that you're taking, remedies. And so just asking all of those questions that we should be asking or already asking can really help our patients and have a huge impact on how they are able to address the effects of climate change.
And Dr. Henry, I want to stay with you just because I'm looking at the time and I know we're near the end of the hour. We had this discussion. I'm really appreciative of the conversation that we had. But how do we, say people, let's get all in on this, right? Let's make sure that we don't miss this opportunity to address health equity by looking at climate change, because if we don't, there's going to be a lot of people that are going to be, those individuals who may not look like you, who may not have the same upbringing, you may not live in your same neighborhoods, they're going to really suffer. So how do we make sure that everybody is all in from the health systems to the healthcare providers, the physicians, the nurses? How do we make sure that we are all in on this issue?
And it's going to take huge advocacy effort. I think it's the same with racial inequities and reckoning and awakening with the murder of George Floyd in 2020. It's going to take us really putting out there in the forefront all the things that have happened. We know already this year, almost 700 people have died from the effects climate hazards, climate change, environmental injustices. And I think we're just putting a name to it. We need to speak out. People consider physicians, clinicians as reputable members of society. And we have to start speaking out in all of our platforms, going to faith-based places, going to the public sector, the private sector, meeting with our public policy makers. We have to make this real to them and let them know that it's not just affecting this population, it's affecting all of us, and that climate change is here and now.
Awesome. Thank you for that. And I think that's a great way to end. I want to just say thank you to our presenters, Dr. Basu, Dr. Dresser, and Dr. Henry. It was a pleasure being in this space with you and learning from you. I want to say thank you to Lynn, who pulled together the presentation, and as always to Dr. Reed, who is the visionary behind the ESJ, as well as the Office for Diversity, Inclusion, and Community Partnership. Lynn, if you don't mind just putting up our last few slides that we have. So just a couple notes. We do have another equity and social justice event that's going to be happening in the new year. We're going to be talking about another emerging issue, pharmacoequity. That's going to be held on January 17th at noon Eastern time. That information will be posted on our website, which you can visit to learn more about this. This is also where our this webinar will be posted and will be closed captioned for any individuals who use closed captioning. There may be a brief survey available, Lynn, if you have it ready. If not, I want to say again, thank you to everyone for joining us, and please enjoy the rest of your afternoon. And please use this opportunity to advocate for opportunities to address climate change and health equity back at your institutions. Thank you for joining us. Take care, everyone.